I'm here with Dr. Joe Finkler, an emergency physician at St. Paul's Hospital's Tech Emergency Center. Dr. Finkler, what is the Lucas chest compression system and how is it helping physicians and staff at St. Paul's Hospital administer emergency resuscitation to patients?
Yeah, the Lucas chest compressor is an automated device that delivers effective and efficient chest compressions on a regular basis, repeatedly, without complaint, without sweat, and without movement. And what it does is allow us to have an extra set of hands while we can connect the device to the patient, and this can deliver CPR or cardiopulmonary compressions while we're in a resuscitation sequence, and then we have an extra set of hands to work around the patient, and we don't have to have someone on the chest doing compressions because the device does it for them. And it does it effectively, efficiently, and smoothly, and it only requires a battery.
Let's see it work.
Here we go. So there it's going, pumping just like a metronome, exactly the amount of compression, the exact rate, and over again, with consistency that only firefighters could match.
All right.
Please get housekeeping to fast track. Housekeeping to fast track, please.
And how is this new piece of technology revolutionizing emergency care at St. Paul's?
Yeah, I think some of us were a little skeptical about this technology when it first came out, because the study showed that it was equivalent to manual compression by humans, but no better. But the thing that we've learned about this device is that because someone's hands are not on the chest and they're not involved, and there's no discussion about who's going to change over after a certain duration of CPR, or who's going to start it, or are they doing okay, that we can now take our minds off the compression, because that's being done effectively and efficiently, and think about other things that need to be done that will enhance the resuscitation of a cardiac arrest victim, like focusing on the cardiac rhythm, focusing on drugs, managing airway, putting in special catheters into the veins and arteries to deliver drugs to the heart and the rest of the body system.
How are you hoping to see the Lucas used in the future?
Well, we're currently using it on almost every patient who comes in who requires chest compressions after an out-of-hospital cardiac arrest, and we've seen some fantastic outcomes. A couple of patients who've had prolonged CPR for at least 30 minutes, 45 minutes have walked out of hospital after a week alive. So we're optimistic that this is going to make a difference, and if it works in our emergency department, we're hoping to expand it to some of the ambulances in the Lower Mainland.
Fantastic. Thank you so much, Dr. Finkler.
No problem. And this was brought to you by Oscar Meyer. No, just kidding.